15-year-old Viola Namugenya has come from Masaka district with her mother to Georgina Eye Clinic and Surgery in Kampala to get an eye transplant. It's going to be her second eye surgery to restore her sight.
I realized it when I was in primary 7. The eye started paining me. At night I couldn't see.
Her eyes were itchy. We first went to Masaka when she was in primary 5 and they recommended glasses but were afraid they could destroy her eyesight. She says her condition deteriorated further.
Cornea is the most important part of the eye. It's the window that lets in light into the eye. And ideally, we're supposed to have a very clear cornea.
Dr. Juliet Otiti, an ophthalmologist and cornea specialist who is about to carry out this surgery, says she has keratoconus, a disorder in which the eye's cornea begins to bulge, causing visual distortion.
So if this is your normal cornea, which is like a part of a sphere, it starts to push forward. It's common in children, and it's also common in those who have a lot of allergies, who have itchy eyes, and then when they rub a lot, it tends to push the contents forward, deforming it.
When this condition gets to advanced stages, doctors recommend a transplant.
In the initial cases, we use other methods, which are conservative, like spectacles, contact lenses, then there are special hard contact lenses. This is the eye we're going to operate.
Viola is meanwhile getting ready for eye transplant, and the doctor shows us what she will go through.
We're going to remove this hazy part of the cornea and replace it with a clear cornea. Let me show you what we did last year. Viola, try. Look straight.
You can.
She had a very bad hazy cornea, so we removed it and we stitched a new cornea on top. And now that's the eye she's using to see, and that's what has enabled her to go back to school.
Viola was gradually going blind in both eyes.
We get tissue from eye banks, and they harvest tissue from people who are willing to donate their tissue to help other people see when they pass on. So someone has to pass on for you to be able to harvest their tissue.
The tissue has to be from a healthy person.
You should not have HIV, hepatitis, and so many other diseases, and there should be no trauma or injury.
Uganda currently doesn't have an eye bank. Most patients in need of surgery have to import eye tissue from abroad. But the Minister of Health seeks to change this state of affairs. It's bringing the matter to the attention of legislators.
So that we can be able to do transplants every day. What is required is a lot, because you need good road networks, you need good intensive care units, you need constant power supply.
Prior to coming here, Viola had been advised to go to India or Kenya.
Now we don't have money.
She got surprised when her sponsors at Compassion International told her that Ugandan doctors were to operate on her.
Corneal transplantation is a very safe procedure if done in the right environment. We do quite a number of transplants, and even towards the end of the year, we always have a cornea camp.
In 2014, Viola had her left eyesight fully restored. She's now getting surgery in her other eye. This is part of the surgery.
Viola, I'm going to clean your eyes, so look down at your feet. You look up, please. Open the eyeball. Up, look right, look left. Okay, look straight.
Many people do fear surgery, and Viola had been given a valid reason.
The people were telling me that if they operate the eye, you are going to be blind. I cried, I prayed to God.
Technology has developed. We have the latest technology to make sure that it is safe and you have good outcomes, minimize all the risks to almost less than 5%. And even when you have any complication, we can manage them.
Viola's diseased cornea has finally been removed, and she's about to receive a fresh one, which is going to enable her to see in both of her eyes. As seen, the surgery that involves soothing music is really delicate, but it goes on slowly, and after 8 hours, Viola, who has been through it before in 2014, comes out yet again, victorious. I have hope. The first eye that was transplanted functions so well. Viola has been able to get her sight fully restored because someone died and had their tissue donated to her. Health officials are calling on Ugandans of all ages to do the same.
It's not the whole eye, it's just the top bit of the eye.
Dr. Titi, however, emphasizes the need for prevention of eye disease, which is on the rise.
The dust and the sunlight, we have a lot of allergies, we have lots of injuries as well that can cause corneal blindness. Then there are some eye problems where you need early detection to prevent blindness. Most common is glaucoma. Glaucoma is raised pressure in the eye.
Florence Naluyimba, NTV.